Hello everybody, my name is Dr. Krithika Murugan. I'm one of the surgeons based out of HCG, Bengaluru. Chemo brain is usually commonly spoken of by patients to address to conditions like cognitive difficulties, memory problems, coordination problems. Chemo brain is a known entity, but then whether somebody develops that or not, the symptoms vary quite a bit. It depends on the kind of tumor you have, the kind of chemotherapy you've taken, how long you've taken chemotherapy for. But the good news is, even if you have all these symptoms, they can easily be addressed with the support of the multidisciplinary team which treats you. Part of them would be the neuropsychologists. They would help you not just cope with whatever difficulties you face during treatment, but also your quality of life later. Interesting question you asked this. Chemo per se doesn't differentiate between a good cell or a bad cell. It attacks every fast growing cell in the body, and that includes tumors, your hair, skin. Those are the obvious side effects that you come across. Once you stop chemo, most of you all tend to return to normal completely, and not just in appearance, but your inner self as well. So the effect of chemo I don't think is for life, but at the same time there could be a few side effects which may linger on for a bit. But again, like I previously said, a multidisciplinary team approach, be it involvement of the dietitian, the physiotherapist, the psycho-oncologist, would help you cope with the side effects better. Definitely not. That is something I can assure you about. We've had patients who come in, take chemotherapy on the recliner ward, go back to work. There are some who pop it just like a pill. So it entirely varies. Your life doesn't have to come to a standstill and should not. In fact, the whole idea of daycare chemotherapy is to try and help you return back to normalcy as quickly as possible. Everybody seems to be talking about immunotherapy, isn't it? How your own cells help you deal with cancer. Immunotherapy may not be suitable for every form of cancer. It is still a growing field. It is still a field which is being researched heavily. It is the buzzword at this point in time, and all the researchers want to look at it in a little bit more detail, but pretty much standard treatments still exist, and chemotherapy is a part of it. Though some form of cancers may make it difficult for you to conceive post end of treatment, there are adequate measures which are taken prior to chemotherapy in the form of fertility preserving procedures, in the form of preserving your eggs or sperms or whatever it may be, to help you have your own child if at all the need arises. So having a child after chemo is definitely possible. We have a number of young breast cancer patients who continue to go on to have a normal motherhood and child after chemo as well. So that is definitely a myth. Breast cancer, like everybody pretty much well knows now, is more of a multidisciplinary approach. We can't harp enough on it. So surgery, chemotherapy, radiation, hormone tablets are a part of the treatment plan. Whichever order it is given in keeps changing. Whether you need one form of therapy or not keeps changing. But then the good news is, the earlier you come, the better the outcomes for you. Early treatment is equal to cure, is what they say. Chemotherapy is an integral part of treating breast cancers. Some may need it, some may not need it, but if you need it, you should go ahead and take it, because at the end of the day, it's the outcome which matters.